Hi everyone, I'm Dr. Kumar. I'm a consultant surgeon at Sunway Medical Center, Ipoh. Today I would like to discuss regarding the evolution of bariatric and metabolic procedure the last 10 to 15 years, and I also would like to share the latest cutting edge procedure SADI-S that we can offer in Sunway Medical Center, Ipoh. When we talk about bariatric and metabolic procedures, there are mainly two main groups. The first one is the resectional type, and the second group is the diversional type. So the first one, the most commonly performed resectional type of surgery is a sleeve gastrectomy. I'm sure everyone has heard of this procedure. Under the second group, the diversional type, there's procedures like gastric bypass, one anastomosis gastric bypass, there's duodenal switch, and the procedure I'm most passionate about, SADI-S. SADI-S stands for single anastomosis duodenal ear bypass with sleeve. So before I go into details about SADI-S, let's just briefly discuss regarding the two more common procedures in the world, the sleeve gastrectomy and the gastric bypass. So let's talk about sleeve gastrectomy. So we do know that it is the most common procedure performed in Malaysia and throughout the world. So when we look at sleeve gastrectomy, it is easily reproducible in trained hands, it has very low surgical risk, and gives you a decent weight loss. But however, in the last few years, there has been growing concerns about sleeve gastrectomy. The main issues is weight regain in the long run, and also development of reflux after the sleeve gastrectomy. And also the most important thing is the inferiority compared to diversional procedures in terms of remission of diabetes, hyperlipidemia, and hypertension. Next, let's look at gastric bypass. So gastric bypass has been a gold standard in terms of metabolic and bariatric procedure the last 40 to 50 years. It gives you excellent weight loss and very good remission of comorbidities. However, gastric bypass has its own sets of limitations and setbacks. There's issues with marginal ulcers, issues with dumping syndrome, and also internal herniation. So what if I tell you there's a procedure that combines the benefit of both sleeve and also gastric bypass, and at the same time eliminates all the shortcomings and their limitations? That's SADI-S procedure for you. So now let's look in depth regarding SADI-S procedure. So SADI-S procedure has two main components to it. The first part of it is creating a standard sleeve gastrectomy. So by preserving the stomach anatomy, albeit much smaller in volume, we are also preserving the pylorus. So this gives you excellent quality of life in terms of drinking and eating. It also avoids dumping syndrome and also marginal ulcers. The second part of the SADI-S, we will create an internal bypass. So we will measure about 300 centimeters of small bowel from your appendix and make a connection just beyond your stomach. So this bypass component gives you a huge neuroendocrine and hormonal changes that gives you an excellent weight loss which is sustainable, excellent remission rate, particularly diabetes, and also a good quality of life. So we do know diabetes is a huge problem in Malaysia. 1 in 6 adults have diabetes or pre-diabetic. So this procedure addresses the issues of obesity as well as diabetes. So the next question you might ask is, why don't you do SADI-S for everyone? So it's not that simple. So in my clinical practice, when a young patient presents to me with obesity, but without any clinical issues of diabetes and hypertension, sleeve gastrectomy would be my procedure of choice. But if you're in a middle-aged group or elderly group struggling with obesity and significant metabolic issues such as diabetes, SADI-S is the procedure of choice. In terms of the traditional gastric bypass, I normally reserve it for those patients who are struggling with reflux and Barrett's metaplasia. So in summary, my take-home message for you is SADI-S gives you excellent weight loss which is sustainable in the long run, gives you excellent remission of comorbidities, particularly diabetes, and gives you a good quality of life. So I personally think SADI-S is the procedure to go to in Malaysia. For those who are interested to know more, my door is always open. feel free to drop by and we can have an open discussion regarding the types of procedure and what's best for your health. Thank you.